Augmented reality isn't new. It provides an engaging atmosphere for students so that they can practice high-risk situations in a low-risk setting.
For me as an educator, it's the ability that you had to drive home the learning objectives.
These games bring the patient to life.
Well, augmented reality is adding reality, something that's not in a situation, to make it more real. So on a football field, when they put the down line down, it is augmented reality. So our digital natives today are used to that environment.
Do you want to hold that up and center it over?
There's 3 ways we can start using augmented reality now. One is to enhance simulation, make it more real than what it's been in the past. We can use it in the classroom to bring life to case studies that we're using in classroom. And we're going to use some gaming now so students can practice these simulations at home.
You know, simulation is already an emotional environment for our students, and some of that emotion comes from the fact that they have to pretend about certain things. They have to pretend about what the leg might look like if there's a wound on it, or they might have to pretend about how a patient actually looks, whether they're sweating, whether they're blue from their cyanosis, or whether they're bleeding from a certain spot.
We have to pretend what the patient looks like. Heart sounds, lung sounds aren't always accurate.
Sometimes when you're dealing with a mannequin, the students have to fake it, but it didn't feel like that. They're actually getting it from a face, and so it's easier for them, I think, to get the reality of it.
I came in here with a little scratch and now I'm sick. No grown man should have to have nurses clean him up. It's not right. I should just leave.
The augmented reality brings realism into it, so they don't have to pretend as much, and it takes that anxiety away from them and allows them to be more emotionally involved with the patient in the simulated environment.
It just seems cleaner and less use of their imagination and just the ability to make it more real.
Currently, our case studies are very textbook-oriented.
Case studies can be dry. Usually it's a description of a patient, maybe some lab work, what they find on assessment.
There's occasionally a picture in a book, but there's not much more to it.
In this situation, we'll have a video of the patient so they know who they're taking care of. It will enhance patient-centered care.
I really need to get back home. My husband calls me during the day to check up on me.
And I think when you can get a video added to it and additional words from the patient, it actually pulls the student into that environment and allows them to be more present.
It's my fault this happened. I wasn't doing my job as a wife.
For me, it was nice to be able to have that more patient video part, to see their face, see what they look like, see the nonverbal cues and the actual, impressions on their face from the abuse.
Just seeing that patient one-on-one instead of just reading it from a textbook just kind of sets things in stone in your mind, like how you would react to that patient.
I think it added an element of realism that you just won't get from a textbook.
Anytime there is increased engagement with the patient, I think there's more critical thinking happening because they're approaching the situation as if they're actually taking care of that person.
That way when they go into clinicals, they have a better understanding of how to deal with those patients because they've actually already, at least on some level, dealt with them before.
So I think it's the emotional impact of the case study that really enhances it. Gaming is just another way to practice what we're learning about in the case study and give them more time at home to learn more about the material and think about how they would react in a situation.
When a student gets into the game, they have the videos there of the patient and they're allowed to interact with them in a low stress environment. They're allowed to repeat those videos over and over again and get immediate feedback and making sure that their answers are the answer that we'd like to see in the clinical environment before they actually get to clinicals.
One of the games is concerning therapeutic communication, and students learn about different therapeutic techniques in the classroom, different barriers that can occur. Part of the game is they're given correct answers and incorrect answers to choose from, and by participating in the game they should be better prepared when they are actually in simulation with what they would say to the patient.
Oftentimes in clinical and in simulation, we work with 1, 2, maybe 6 students, and it's pre-planned a little, but not as fine-tuned as this can be.
The grant required that you add a piece of computer-based learning, technology-based learning, and it's based on best practice in learning. So we were looking where in healthcare and what kind of technology would be the best fit.
So augmented reality gives us the ability to do that. It's really endless if you think about it.